In a country known for its universal health care, Canadians assume if they get sick, they'll get treatment. But what if you have a mystery illness that defies diagnosis? Once again, here's Jennifer Tryon.
Happy birthday to you. Cha, cha, cha.
On the surface, Avery's family is trying to make life as normal as possible.
He's making a huge wish.
Wishing he could have a piece of his birthday cake or anything real to eat at all. Instead, night after night, Avery Cases is suffering. Chronic stomach pain, nausea, and vomiting. He can barely eat.
It just came on bad. I am nauseous. And my stomach is hurting.
Now 13, he's spent most of his childhood on a seesaw of diagnoses. Lots of theories, but no real answers, and certainly no cure.
He's pain-free for the first time in months. He's even hungry. He's seizing.
It's not always like we see on TV, where there are specialists for every imaginable ailment, and the mystery illness is solved at the end of the hour.
It worked.
The medicine worked.
It worked.
For over 4 years, Avery has seen more than 20 doctors at Toronto's Sick Kids Hospital. We contacted all of them. Many agreed that going undiagnosed was a topic that needed more attention, but not many wanted to speak with us about it. In fact, we asked the Royal College of Physicians and Surgeons and the Canadian Medical Association what policies existed to guide doctors if they were stumped. The reality is, there are no policies, and no one would go on camera. Of the 20 doctors we contacted here about Avery, just one agreed to speak with us. Meet pain specialist Dr. Fiona Campbell.
Nice to meet you too.
She's seeing more and more Canadians with unexplained illnesses.
It would be more than half, so it is a substantial proportion of the children that we see. About 20% of presenting complaints don't receive diagnosis, so they remain as a medically unexplained symptom.
She examined Avery at her pain clinic at Sick Kids a number of times.
I really believe that health professionals are really trying to do what's best for children and families, and it's not all black and white in medicine.
After a number of stays in hospital, Sick Kids finally discovered something that fit Avery's symptoms.
It's this rare disease called Eosinophilic-Gastroenteritis.
Eosinophilic-Gastroenteritis. It's a mouthful. That means his body reacts as if he's having an allergic reaction to everything he eats, forcing the food back up.
I'm not really having an allergic reaction, so I just throw up whatever I eat.
So the cases were referred to a specialist in Boston, an expert in this rare allergy to all food.
You could just see his whole personality, happy, eating, wanted to eat everything.
I'm feeling great right now. I feel so good.
For 3 weeks, almost 4, he had no pain. Nothing, no pain at all.
Then, just as suddenly as the pain stopped,
my stomach hurts, my stomach hurts. It all started again.
They had given the biopsy to the doctor who sets the standards
for diagnosing
EG. The doctor said, he doesn't have it. As parents, you're saying, what do you do?
When they came to the end of their expertise and they referred to the people they knew, it ended. And no one kind of went beyond their expertise. And that's the frustrating thing.
Dr. Fiona Campbell sees the frustration every day and suggests at some point, as hard as it is, patients have to move on with their life and begin to live with their illness.
Sometimes the searching for a diagnosis in perpetuity can become more of a barrier to coping and well-being.
Tammy Stanton has taken control of her symptoms. The naturopath suggested she might have a food sensitivity. She hasn't had hives or a fever since.
After 13 months, I'm gonna get emotional of feeling so crappy for so long. I'm hopeful now, and that feels good.
Shannon Kleinhaus is still searching for an alternative treatment to prednisone.
See if I can find some results here, and maybe, I'll find some results at home or in some other city.
Bit of motivation right there too, eh?
Yeah, because I want to be healthy in the future so we can throw the ball around or play some hockey. Can't do that if I'm going to be sitting on the couch or laying in bed.
And for Avery,
we're not going to stop. We have to get him healthy.
I made a promise to Avery, and I said that as long as you don't give up, I won't give up.